I'm Dr. Lena Prado. I'm the president of Caloosa Veterinary Medical Society. We have a speaker, Daniel. We're going over the advanced veterinary regenerative medicine. Some of the clinics have used their products before and had a very good result with it. So just let's see what they have more to offer us. Take over. You're welcome.
Well, thank you everyone for being here today, and thank you for the Caloosa Veterinary Medical Association for having us also. Today we're going to talk about advances in veterinary regenerative medicine and how those advances have contributed to new ways for you to be able to treat wound care, soft tissue surgery, orthopedics, ophthalmology, and even oncology. The key takeaways that you will get today is why there's a need for regenerative medicine, how you can take those ways and use them within your own practice, and the specific ways that you would be able to do that as well. My name is Daniel Sheres. I'm the Regional Sales Manager from Vetrix, and today I'm also joined by Dr. Bill Kroll from Viscaya Prado Veterinary Hospital. And he's going to share his experience of over 28 years?
Yes.
Veterinary using this within the past year or so as well. If you have any questions, please wait till the very end. We should have a few minutes for Q&A, and if I'm not able to get to your questions, I do have a booth set up downstairs. I'd be happy to speak with each and every one of you guys throughout the weekend. So, as we know, humans and animals have immense natural healing capabilities. If you cut your leg, the cells rapidly divide to clot and stop the bleeding. If a degloving occurs on a cat or a dog, a similar reaction occurs as well to stop the bleeding and help to heal. Even reptiles can lose their full tail, and they're able to regrow the tail. Now, while these natural healing capabilities are extraordinary, some of them can lead to further complications when an unorganized healing occurs. So how do you solve that issue? How do you make sure that it's going to heal correctly every time? The way that we've done it before in the past is by using something known as regenerative medicine. And the traditional way of regenerative medicine is shown above. You would have a matrix, you would then form a construct, you would harvest the cells from the tissue, put it together in a culture or bioreactor, and then you would place it into the area that you're trying to regrow. This is very similar to a skin graft. Now, anyone out there who's done a skin graft before will tell you one of two things. It either works or it doesn't work. And I don't know about you guys, I don't like having a 50-50 chance of what I'm currently doing working, especially when it's a very dire situation. You only have one opportunity for it to work. When it does work, obviously it works beautifully. And when it doesn't, the typical reaction that you have is the body rejects the area that or the matrix that your implant's in, which once again, if you only have one opportunity to get it right, it's not the response that you want. So is there a way to be able to provide that matrix within that patient or organism that you're working on where it won't reject it and it's able to regrow organized healthy tissue? The answer is yes. It's by using something known as extracellular matrix technology. Now, what an extracellular matrix is we're made up of two different things. Made up of cells and the surrounding matrix that holds those cells together. That is the extracellular matrix. It's what provides function and form for your tissue, muscles, and organs. Everything in your body is held together by an extracellular matrix. So how can we use the extracellular matrix to ensure an organized, healthy healing? We do that by using something known as biosys. And biosys is a decellularized extracellular matrix derived from porcine small intestinal submucosa. How it works is you would take the graft and you would implant it where you're trying to regrow the tissue. Let's say you're working on a mass removal or degloving, for example. And what it does is once it's surgically implanted, it tells the cells where to migrate onto it, sends signals to the patient's native cells. Those cells then migrate onto the matrix. They lay down their own collagen matrix. And the end result is they fully populate the graft, leaving behind no foreign body or material. So unlike a synthetic graft or a polypropylene mesh, you don't have to go back in and remove this wherever you place it because it's fully populated with organized, healthy tissue. An example of what this looks like, this was done on a 6-year-old English Mastiff. And the thing I like about this case is you guys get to see the whole progression of utilizing the matrix. It also highlights 2 things you need to know when you go to use the matrix. Those 2 things are you need to have blood supply, and it needs to be able to mimic the function of the tissue around it. So as you can see, it's in a high mobility area being on the rear limb. And after we had finished the surgery, we did have the patient moving and walking around on it because we wanted these cells to migrate to it and know the form that it needs to. In various studies, we've seen that if you don't have the form around it and it doesn't know how to mimic the function of the tissue, then the graft ends up dissolving away because it doesn't know what it's supposed to grow into. The cells don't. So continuing on this, as you can see, the very beginning, those pictures were done pre-surgery. Then this one right here, this was done right after surgery. The next photo is going to be 5 days post-surgery. Then you're looking at 11 days, 18 days, and finally 10 weeks post-surgery altogether. Now I want everyone to take a look at, this picture right here. When you see that, typically you would think probably infection, right? That's actually not. And that's exactly what you want to see, because that's the cells migrating on the graft, and they're just populating the graft at that time. It's not fully incorporated in. When you look at the following picture where it's 11 days, you see that yellow discoloration is no longer there. Now, Dr. Kroll has had an opportunity to be able to use this on a few patients, and he's going to go over his experience in those cases.
So this one here, you can't see the dog's head, but it's a Basset Hound mix, and it came in May, about the middle of the month. One of the doctors saw it, did a fine needle on it, and sent it out to IDEX. Came back as a spindle cell tumor suggestive of sarcomas. So the next step a week later was to go in and remove. So they did, and the surgery was closed. Within 2, maybe 3 weeks, it had grown back. And this was a grade 2 sarcoma. Normally, you know, when they're graded, it depends on the mitotic figures. This one apparently had 11 per 10 high power field. And the concern is, you know, if it's grade 1, 7% chance of recurrence. If it's grade 2, they have 35% chance of recurrence. 3s are at the 75 mark. This was a 2, and within weeks it had come back. So a third procedure was then done, and at that time we had instilled the Biosys matrix in the surgery site itself. So imagine, we'll have a marker, but imagine we take and we, you know, this thing is a big mass, and we just take that out, and now it's got this open gaping wound. We suture the 2, in this case grafts because of the distance it was, in place, and then close the skin back up over it. Now, in retrospect, and then there's another case we did this to, I think we're going to start putting drains in because of the dead space. This one happened to have a pretty bad seroma that got infected. But ultimately, once it healed, now we're 6 weeks out. This photo shows 6 weeks out, and there is no regrowth at all along that incision line. So that was a kind of promising case, since it had recurred twice within weeks, and a few weeks of removal. Now we're 6 weeks out. Don't know how long we'll have, but we're anxious to keep following up on this case. Oh, you want? Okay, this is a Kuma, and a Kuma is a husky. He usually comes in with his brother, and they two look at you like, all right, where's my treat? Right off the bat, they're looking up for it. Sweetest dog. Had a soft tissue mass on the side of his neck. You really can't tell on this view or this view, because guess what? They have a lot of hair. so it does hide those things. But he had this tumor, and actually, he had it removed initially in January of this year. Came back as a grade 2 sarcoma and grew back by March. So it was pretty much end of January, February 10th, I think I got the, or 8th, I got the result back. It was a grade 2 sarcoma, spindle cell, dirty margins. For those of you who don't know, less than 1.1 centimeters of clean margin existed with that. So generally, when you're talking sarcoma, they're spindle cells. These are long cells that tend to go down, they tend to go deep into the tissue. That's what makes them so tough. You can get the expansile growth, but you can't always get the deep. In this dog, it ended up getting into his jugular and around that, which made it really tough, because you really can't remove things that they need, like the jugular vein. So we did a surgery in January, second surgery in March. I get this case in May, back again, big as ever. So took the dog to surgery. At that time, and we'll get into the vaccine, we did the surgery, we did a series of vaccines. It did recur, so back for a fourth surgery. At this point, this thing was just horrendous. 12 by 12 centimeters, deep, irregular. Went in there, the jugular vein was just covered with it. Debulked, you could see tumor where this was taken out. So I just thought, well, we're just doing more of a cosmetic debulking than we are doing this dog any favors. But at the same time, we implanted the Biosys matrix. Again, we put 2 in there. And backing up a bit, the third surgery he had regrowth at suture removal. That was 14 days. Came in after the Biosys for suture removal. Actually, it was a little late, about 16 days, and it was clean. There was no tumor. And I was like, what? Where is it? It's there. I know it's there. I left it there. I could see it with my naked eye. The other surgeries that we had done were actually, your naked eyes show clean, but he had dirty margins. And interestingly, his tumor went from a grade 2 after the second procedure to a grade 3 after the third procedure. So I just don't, in terms of looking at the grades of tumors and how you're telling your clients what to expect, I'm not sure I can say, oh yeah, it's a grade 2, 35%. So that means 65% won't come back. I don't think I would be that so inclined to say those things, given the cases that we're seeing, here lately. There's another case that I'm not presenting that actually Oliver had his tumor removed off of his forearm, his antebrachium. It was a grade 2, it was a dirty margin, they just wanted to see what it was. 3 weeks later, it was marginally cleaned. They took off the margins because they wanted to get as much as they could. 3 weeks later, that same tumor was a grade 3 sarcoma, soft tissue sarcoma. So, I don't know if you can use the grading system as a rule of thumb, but at any rate, these cases, tended to give me a pause to think, wow, that's really cool. The uncool part of Kuma's history is that I think the end of July, I think it was the 31st, I saw him back, and he had regrowth. But his regrowth, okay, again, this is his incision. This is all clean. It's right here. you can actually draw the line as to where the edge of the biosis matrix and the regrowth is. And it was just amazing for me to think, all right, this is a matrix that's supposed to enhance cellular healing. Normal cells are going to heal across it, but what it also does is it prevents cancer cells from actually adhering and growing. So far, it seems to have done so in this dog where nothing else had. Yeah?
A question, was this approach just surgical? Or do we do any ancillary chemo, radiation, or anything like that at all, or just strictly surgery for this?
Surgery, we'll get into the vaccine. This dog actually had 2 rounds of the Vetrix, which is going to be discussed. Daniel's going to present that here in his next section of the talk, which is, I think, 5 or 10 minutes. But this dog had 2 rounds of vaccine. What's done there is we take a section of the tumor, send part of it for our pathology, and the other part goes to the Vetrix people, and they actually formulate a vaccine with antibodies against that particular tumor cell. So that's what this dog had otherwise. No, there was no other chemotherapeutic agents utilized, or radiation was not.
Did the owner decline these?
Correct.
Altogether?
Correct. The owner declined radiation, and other chemotherapeutics. And I think that's the way people are going these days. They've seen that chemo radiation has been around for years and years. And unless you're doing a targeted approach these days, targeted approach means that you're giving a substance that's actually going to go after the tumor cells alone and leave everything else be. Unless that's the case, I think most people are kind of swinging the other way. You do have some that will go the chemo route or radiation, but you are taking out the healthy one with the cancer cells, so of course so. So yeah, so all this one was surgery mainly, and now we're going to do his. We're going to remove the growth that has come back and put another biosis implant in, and she does not want to do the vaccine for that. Okay. Any other questions? I'll be up again. And then you can ask at the end of this.
So you guys can see as well, the biosis graft is used on the human side and the veterinarian side also. A company called Oasis uses this for burn patients. There's other companies that utilize it for cardiovascular heart valves in premature infants, gastrointestinal surgeries, muscular defects. Just about everything that we utilize it for on the veterinarian side, they do it on the human side as well using the same graft. So the question always is what if you need this type of healing to occur, but you don't want to do surgery? Maybe too much for the patient because of age or other complications. It may be unnecessary, but you know you need some sort of healing to occur. What do you do then? And we recognize that problem, which is why we explored and started using something known as amniotic membrane technology. And before I get into exactly how we utilize it, I want to go over why amnion and what the additional factors that amnion brings to the table, which makes it beneficial to use. So amnion is immunoprivileged, specifically because of where it's coming from, and it has the additional growth factors and immunogens to help recover and heal wounds quicker. What it's been shown to do is it actually stimulates cellular activity, including proliferation and migration, which helps with repair of tendons, ligaments, and it even helps with repair of cartilage and joint spaces, as well as it recruits reparative adult stem cells. And it's been shown to be effective in healing various dermal and soft tissue wounds. As a matter of fact, in a 2016 study done on amnion, it was shown that it's an attractive method for grafting for wounds because of its unique properties, such as anti-inflammatory effects, wound protection, decreased scarring, pain reduction, and even epithelialization and initialization capacities. So how we utilize the amniotic membrane is we get ours from bovine and comes in a powder form, which is known as a product called helion. So helion being a bovine amniotic membrane in a particulate instead of the graft. What you'll do by utilizing that is you're going to be able to modulate the inflammation, reduce the scar tissue formation, and enhance the overall healing. In this video I'm going to show you right here, it's going to show how to actually apply it on. Excuse background noise. And it just puffs on there very easily and incorporates in. So in case of what this looks like, this was done by Dr. Eric Herman at Affiliated Veterinary Specialist up in Gainesville, Florida. This was with a single application of the powder onto the wound. It was a lab mix that was presented with a trauma wound underneath the limb, and the picture showing from left to right going down, that was pre-application. And then 5 days, 14 days, 21 days, finally 27 days post-application altogether. Now, as you guys can see, in this case, I do believe they were able to bandage it up, but if it's in a high mobility area or an area that's very difficult to bandage, you can leave the wound site open. You may have to apply it more than once because of the external factors, but once you puff it on there, it incorporates into the wound very quickly, so you won't even notice that it's really there. If it gets rubbed off or licked off, that's fine, just reapply it and it will continue the healing as it's supposed to. Another case, this was done by Dr. Stephen Whittle at Paces Ferry Veterinary Clinic in Atlanta, Georgia. With one application on the gloving that was done on a boxer, he was able to heal it up in 23 days. So as Dr. Kroll mentioned earlier, using an extracellular matrix and where he implanted it, we found that cancer cells are unable to grow onto the graft. And this has actually been proven in many publications and studies. What it actually shows underneath the microscope, if you're looking at it, is where the cancer or where the graft is implanted, the patient's native cells are migrating on there and the cancer cells just kind of bounce off on the edge and they don't regrow. So by knowing that, researchers realized, why can't we use this to be able to combat cancer? And that's exactly what happened. About 15 years ago, Dr. Mark Suckow, pictured here, was doing immunotherapy research on the human side. His dog, Sadie, pictured there as well, was diagnosed with a squamous cell carcinoma during that time. He had to bring the news home to his family that Sadie didn't have very long to live. And his daughter said, well, Dad, you work with cancer patients all the time. Why can't you take the research that you're currently doing and use it to try to help Sadie? And he had never really thought about it at that point in time, because if you guys all think 15 years ago, the veterinarian field and what people were willing to do is very different than what they're willing to do now. They're willing to spend more money, they're willing to try new things to save their pet. So what he did is he decided to do the research that he was doing on the human side, bring it over to the veterinarian side, and brought it with the veterinarian he was working to. Said, I want you to remove the tumor. He created a vaccine out of it, and they injected the vaccine back into Sadie. Sadie died 3 years later, completely cancer-free. She succumbed to natural causes. So he realized that they were onto something, and they definitely had something. And he partnered with a few veterinarians that he went to vet school and a few colleagues with, and they created Vetivax. Now what Vetivax is a revolutionary veterinary cancer treatment that uses the patient's own tumor to create a personalized response to kill that cancer, or to elicit a response against that cancer. How it works is you guys would resect the tumor like normal, send part of it off to histopath, because you still want to confirm it's cancerous, and then send the other portion off to us. What we do is we then dissociate down to single cell suspension, render the cells deactivated, and preserve the outside tumor-associated antigens. From there, we combine those tumor-associated antigens with the SIS, the extracellular matrix, the nanoparticulate at the point in time, so it's not the graft. But what that does is that's a sticky vehicle for presentation of those tumor-associated antigens back into the patient's immune system, which once they're presented to the phagocytes, they then train the cytotoxic T cells to recognize the tumor-associated antigens as foreign, creating a specific response to that specific cancer with the specificity to kill the tumor cells. When you do go to inject the vaccine is a dose of 3 vaccines, 1 per week, over 3 weeks, and you're going to go down to the sub-Q at the nearest profile lymph node. Vetrix is designed for solid-based tumor, any type of solid-based tumors. These are a few examples of the most common ones we've seen. We have treated over 31 different tumor types to date. A lot of the ones that are up here are the most common. You guys probably see are fibrosarcomas, mast cell tumors, basal cell carcinomas, nasal carcinomas, soft tissue sarcomas, and so on. So what has been shown is we have safety data in over 260 patients. The efficacy data that's been shown in those is 70% of them have made it past their median survival time, depending on the specific cancer that they're looking or the specific cancer that you're treating. Any type of reactions that's been occurred are grades 1 out of 5, and they're typical reactions that you get for any type of vaccine. So mild lethargia, mild injection site redness, and so on. And going back to the efficacy data, the other 30% who didn't make it past their mean survival time, the majority of them are still being monitored, and they just haven't made it past because of the specific cancer. And if they did succumb to other causes, then that's why they were taken out of the study as well. But there's not many that have actually succumbed to the cancer itself. The cost of the treatment to you guys costs $900, which when you think about it is significantly cheaper than having to refer your patients out. Not only are you keeping the revenue within your practice, but your patient also isn't paying a minimum of $5,000 for the continuous travel back and forth to do chemo or radiation. Comparisons to the other treatments, if you go into an exam room and you have to share the news with that family that you want to do chemo, the first thing they're going to think is my aunt, my sister, my cousin, somebody in my family went through chemo and I don't want to put my dog through that. Similarly with radiation as well. So what you're doing is you're providing an alternative treatment for them to be able to do for their dogs that's only using the patient's immune system and not diminishing the lifestyle that that patient currently has. Now, Dr. Kroll has had an opportunity to be able to use it on a few patients, and he's going to go over those cases. He's also going to discuss how he brings it into his practice and has that conversation with his patients when they are diagnosed, and he has this opportunity to provide the vaccine for them.
So this guy here is Fozzie. Fozzie's a 9-year-old golden doodle, neuter male, and he presented with about a grape-sized black nodule below that left eye there in this area here. This is post 8 weeks out now, so it's not grown back. We gave him the 3 doses of the Vetrix after surgery. Surgery was done, you know, you get in there, you take it out, you think, great, you got a big, you know, margin, whatnot. His was less than 0.1 margins. It was very narrowly excised. And so we went ahead with the vaccine, thought, well, we could go back in and do a wider excisional. Let's see what the vaccine does. And as I said, this is beyond 8 weeks, and there's been no regrowth. Looks normal. Can't even tell that he's had that, you know, situation. Melanoma is a little different than your sarcomas because it doesn't have to just come back where it's found. It can come back anywhere. And the behavior of the tumor has to be taken into account too. If it's in the oral cavity, nail beds, feet, you know, areas of that nature, melanomas have a much higher rate of metastasis and chances of coming back than if they're in, you know, other areas of the whole body. In this area, it happened to be a good spot for a melanoma because if you get it, you know, but again, we weren't sure that we got it with that less than 0.1 margin, so we put him on the vaccine, and it seemed to work. Interestingly, he was one of the 3rd vaccines that we gave. The vaccine came back and you drew it up and it was black. Whereas the others were like a amber color for the sarcomas. So I guess they truly do contain, you know, what is in the malignant melanoma there to combat it from coming back again. So far, so good. So we'll see for him.
And how do you position it to your clients?
To, you know, and so it's $900, you know, the vaccine for our cost. So we upcharge $1,300. And, you know, I tell them right off the bat, it's not cheap. But you're not cheap when you go through chemo, you go through radiation. It's just, you're not going to be paying a few $100s for these procedures. They just aren't inexpensive. So far, I haven't had anybody balk. You know, I mean, you know, there's a few that were like, oh, I can't do that. I get that. You know, we all get that. Nobody has that kind of money to shell out every day, but they're out there. The people that I've presented it to, you know, generally say okay, and so we're good with it. Yeah.
Yeah, are there any other ancillary tests you need to run with that, or once you get your diagnosis, you send it to those guys and just go to work?
Correct. The melanoma, what they do, what I do, is I'll save a chunk of the tumor and I'll put it in the freezer, not in formalin. And then the other goes to the lab for analysis. When I get the report back, we take the report, take the tumor out of the freezer, and FedEx it to Vetrix. And that's what they do, is they take it from there, make their vaccine from it, and then send it back. All that happens within a week. I mean, these people are incredible as far as the company is concerned. I called him the other day and I needed more mesh. I got it the next day. So it really is, you know, you do get turnaround. And in these cases, some of these sarcomas are growing at a rate that you can't believe. So it is good that you get that kind of turnaround and whatnot. There's a form that the client signs, and it goes through all the potential side effects, like a vaccine side effect thing. You know, I'm sure just like any vaccine that has gone through testing and whatnot, this dog got diarrhea, this dog vomited, this one had an urticarial reaction, what have you. So all of these are addressed in that, and so we present that to the client, they read through, sign, and then that, basically that also goes with the